Portugal is the global leader in vaccinating against COVID. Nearly 85% of the population is fully inoculated. Anti-vaxers are few and far between. Three things saved Portugal: an organisation, which we had with the military, a structure with the Ministry of Health, and the population, the community. The naval commander has been in charge of combating the pandemic. He says Portugal has won the battle and should be a role model for other countries. I'm Ben Fazulan, good to have you along. Portugal is winding down its military-led vaccine task force now that it's pretty much reached its targets. The nation's also set to scrap most of its pandemic restrictions from Friday. Prime Minister Antonio Costa says many people deserve credit for the country's vaccine rollout, but he singles out Portugal's acceptance of vaccinations as the prime reason for success.
Just before the first day of school comes the second vaccine shot. 13-year-old Gustavo visits a vaccination center with his mother, Mafalda Serra. Protecting her son against COVID-19 was a clear choice. Portugal set ambitious goals for its inoculation program over the summer, expanding it and including children aged 12 to 15. Memories are still fresh of previous infection waves, which hit the country hard. Last winter, this sports hall housed COVID-19 patients. Now it hosts vaccination booths.
We've been active and open in our communication about vaccinations and the campaign. That was very important. It created a feeling of community involvement and participation. We're not self-centered here. We're not afraid of getting vaccinated.
The low level of vaccine skepticism here has much to do with Portugal's history. The public health system was only founded in the 1970s after the country's revolution. Child mortality rates ran high. Ana Esteves once worked as a doctor in this children's hospital in Lisbon. Returning with her granddaughter, she recalls the dramatic health situation of the past. In those days, it was normal for 2 children to die from measles and another one from diphtheria. People thought it was just part of life. Today, that would never be accepted. The vaccines give us the possibility to do more than we could during the lockdown. We had to give up so many things. Only now can we get back to doing them. Like many students, Vera completed her schooling under extremely difficult circumstances. During 2 consecutive years, classes were suspended for several months. It's hoped that the new school year in Portugal will be different. All students will be tested, even if they're vaccinated. And masks will have to be worn inside and outside.
Our goal is to give the students as much time in the classroom as possible. We know that in-person learning has far more positive effects than online education.
And so during the school holidays, Portugal organized children vaccination weekends. Almost all adults have now been inoculated, and around half of those aged 12 to 17. Hardly anyone refuses to get the shot. People's trust is paying off. The Portuguese government and its experts are expected to soon ease the remaining pandemic restrictions.
Let's talk about vaccines with Joe Brazzi. He joins us from the Task Force for Global Health. So what can the rest of the world learn from Portugal?
Yeah, I think the piece pointed out a couple of real key features that Portugal and other countries that have had high vaccine coverage rates, high success rates with COVID share. First, they have strong immunization programs to start with. They've done well with measles, with childhood immunizations, and using that infrastructure, using those systems, the trained health workers, the systems to monitor vaccination, all play into doing well with COVID vaccine. The other thing they have is low, as you mentioned, low vaccine hesitancy or anti-vaccine sentiment, and this actually is a derivative. It comes from having a strong historical system that builds trust in the community and the very target populations you want. The third thing, though, is worth mentioning with Portugal and other countries that have done well is they've molded those systems, they've modified them, they've refined them to some extent to address the key sort of specific, unique situation of COVID, where you have boluses of vaccine that get to country and you need to mobilize them at a national level to all age groups very quickly. And so I think Portugal's use of mass vaccination clinics, of high throughput clinics, give the opportunity of greater access to people all around the country. And I think that's been replicated elsewhere in countries that have done really well with vaccine.
Joe, are there other factors involved that determine whether or not a vaccination program is successful in a particular country?
Yeah, really the three main factors, the three main areas of work are: can you get the vaccine? Can the government get enough vaccine for the people? Are there systems that deliver the vaccine efficiently and timely way? And will people take it? I think those are the three sort of areas of work that most governments engage in. I think if you struggle in any of these things, whether you can't get the vaccine or have slow systems or you have a reluctant population, any of those things will cause governments to struggle with raising their vaccination rates quickly.
So what do governments need to be doing to avoid those problems, those struggles, and those setbacks in any vaccination drive?
Well, I think the governments are clearly responsible for getting the vaccine, for buying the vaccine in some way, getting the vaccine donated, getting it into the country, and distributing it to the clinics. They're also responsible for clear, consistent, true messaging to the population. The challenge, of course, is the government is not the only actor here. And in fact, this third arm, getting people to take the vaccine, is tricky. And it's often tricky in countries that have some distrust of their government as true kind of faithful messengers of public health. And so engaging a whole society approach where you get faith leaders or business leaders, scientific leaders, healthcare system, community leaders, all engaged in the enterprise of delivering messages, of educating people, of delivering clear, consistent messaging are really crucial to making the vaccine program work well.
So basically what you're saying is this all comes down to good governance, the ability of a government to work with its various departments, various bodies, to ensure that one message is sent to the people, and that's also mirrored in the government's actions in buying those vaccine, first of all, and also distributing them effectively.
Yeah, I think that's part of it. I think good governance is key. And I think where you see very low vaccine coverage rates in Africa, for instance, part of the problem is getting the vaccine itself, but part of the problem also is in the strength of the systems to deliver the vaccine. A lot of the work we do is helping low and middle income countries actually deliver the vaccine and strengthen the system so that they can actually get the vaccine into people's arms. So government is part of it, but I think really a key part of this third part, which is getting the vaccine in arms, is partnerships. I think the government doesn't do it alone in any country, and partnering with the various civil society groups that actually can engender trust and deliver key messages to the population that actually needs the vaccine are critical.
What's so hard about setting up those partnerships?
I think it's difficult for a lot of reasons, but one of the key problems is that if you're trying to vaccinate adults for the first time, and many countries don't have any adult vaccination program, so you're building this adult vaccination program for the first time ever in these countries. And so adults aren't used to being targeted for vaccines, so they come to the enterprise with different education levels, different age groups, different experiences, different trust levels. And each of those populations, whether you're a health worker, an elderly person, a diabetic, whether you're urban or rural, may have a different message that is effective in getting them to the vaccine clinic. And so countries need to understand both who they're targeting, what their messages need to be that'll be variable all around the country potentially, and find the partnerships to deliver those messages effectively. It's a fairly complex process to get people into the vaccine clinic in many countries.
Joe Brazil, great to have you on the show today. Thank you.
Pleasure. Thanks.
Derek's turn to answer your questions on the coronavirus. Keep sending them in to our YouTube channel.
Is it better for countries to vaccinate with a range of vaccines instead of only using one type?
This is another of those questions that science won't be able to answer while we're still kind of in midstream with the pandemic. We'll have to wait, I think, until we've crossed over to the other side and can look back at it to come up with assessments on really big questions about what we got right and what we got wrong. But that said, there's certainly one big thing to bear in mind when looking at this issue, which is that we're trying to vaccinate billions of people all over the planet as quickly as possible. Now, I've said the word unprecedented many, many times on this show, and I have to say it again here. This vaccination drive is unprecedented. We're in totally new territory, and it's clear that in this race, we have to use every tool at our disposal. And safe and effective vaccines are the most powerful tool that we have. So if exhaustive trials prove that a vaccine is safe and that it's effective, then the most important thing is to get it into as many arms as possible, as quickly as possible, regardless of manufacturer or platform. For most countries, for obvious reasons, that's going to mean using a range of vaccines from a range of manufacturers. In this situation, trying to decide if it's better for countries to vaccinate with a variety of vaccines instead of one perfect one is like asking which vaccine is best. You can't answer that. Certainly not now. And if you tried, you'd likely be saying something else next week or next month as the pandemic evolves and as we learn more. But I will say that, to me at least, the old proverb about not putting all of your eggs in one basket makes sense here as well. After all, betting on a range of products spreads the risk if some vaccines don't prove as effective against variants or as long-lasting as we'd hoped.